As the state moves toward reopening the economy, elected officials in Boston are trying to make sure it's safe for local residents. If the pandemic has exposed a long pattern of inequality, the same goes to the reopening with different levels of risk and hardship for different populations. One of those calling for attention to those concerns is Boston City Councilor at Large, Michelle Wu. Thank you very much for being with us, Councilor.
Thank you for having me.
Because I want to start with where we all stand right now as far as risk. You got your results back and you have antibodies. I should congratulate you maybe. But what about the test results for the whole city of Boston? What do you see in those results as far as where they're pointing?
Yeah, so about 750 residents of the city were tested across 3 different neighborhoods. It was Rosendale, East Boston, and a few parts of Dorchester. And what we found overall was that a significant number of people, 10% of people, had antibodies, but there were also many people who had antibodies and were not positive for the virus at the same time, meaning that they had likely had it at one point without knowing it and potentially were spreading it then. So, there are a couple things. One is that we are nowhere near the level of kind of mass presence of antibodies that would allow us to kind of immediately reopen without thinking a second thought. There's still a lot of caution needed in terms of protecting ourselves and each other from the transmission. And it's especially important to have that focus on keeping masks on and protecting yourself and protecting others, even if you feel perfectly fine. Because as I experienced with my own test result as part of that study, there are many people who might have had the virus and did not realize they had it at the time, and therefore we have to be cautious at all times.
I don't know where I stand, but when I go out, I put on a mask. Luckily, the streets are pretty depopulated in my neighborhood, but I still find that when there are other people around, half the time I'm stepping into the street to avoid them. So what should the city be doing about things like that?
Yes, many other cities across the country and the world are actually taking action just for that. At its heart, this COVID pandemic is about space, right? The ability for some people to have more space to isolate themselves at home, and then the risk and exposure when people don't have the luxury of staying home, whether it's because you're an essential worker or you live in a denser, sort of more populated housing structure. So what this means is that every bit of how we live our lives and how we think about the distance between ourselves and other people is now a public health policy consideration. So other cities around the world are reallocating street space, really thinking about how we might either expand the sidewalk into the street for a little bit, kind of designate an extra zone in the street for people to walk or bike or travel safely as they're outside, or to think about whether there are certain streets that are shut down altogether to vehicle traffic just to make it safer and people can kind of spread out into the entire street. This is a consideration for small businesses as well. Many of our restaurants are really struggling, and it would help to be able to expand into patio space, and many other businesses would be able to more safely conduct their business if they were allowed larger curbside pickup space or room outside for people to line up outside the business. So we had a hearing at the City Council last week focused on safe street space as well as safe public transportation, which is another set of considerations.
Well, just as an exercise, think about your own part of the city in Rosendale, around the village. You've got a lot of vehicular traffic, you've got a lot of restaurants that would like to be back in business, and you got residents who want to walk around safely. How would you solve that problem?
Yeah, in fact, Rosendale had already begun taking steps prior to the pandemic to think about this exact issue. One is that we have a very active local advocacy organization called Walk Up Rosendale. And so over a series of months, they had conducted a walk audit and worked with the city's transportation department to put down different posts and restripe certain crosswalks and give more space so that people didn't have to always peek around the vehicles to see whether the street was clear before crossing. So there were already some improvements made. We're also one of the first parts of the city to close down, pedestrianize a smaller street, Birch Street, which connects two of the larger thoroughfares and is very narrow. It's a street that I've even witnessed several times just as I'm walking by, a car going by and then knocking a driver's side mirror off of another vehicle. It's so tight So that will actually be cleared of vehicles altogether, pedestrianized to create that safe space. And the other thing that we need to think about is whether we're allowing for public transit to have extra priority in that sort of interflow as well.
What about transit? Because as people start going back to work in larger numbers, we don't want to repeat the scene that we saw on Twitter recently with those people packed on the Silver Line bus. How do you avoid that?
Yes, in fact, that is perhaps the top concern that I hear from local business owners as they're planning out how they might reopen is we want our workers to be safe. We don't feel comfortable with sending people back onto the T because so many of our essential workers and restaurant workers or those who are in the hospitality industry or who are employees at our small businesses rely on the T every day. You know, maybe can't afford a car or it's just the way that is most direct for them to get to where they need to go. You know, no parking in a lot of Boston. So if the T is in question as to whether that is safe and healthy, then that kind of freezes so much of the economic activity in terms of both ends of where people are and where they're trying to go. We've seen best practices from cities across the world that have had much more success in controlling this virus. Places like South Korea and New Zealand and Taiwan, where public transit is a focus. Some of those cities have mask distribution as people are going into the subways. There's hand sanitizer available. Some of them even conduct temperature checks just to make sure that anybody who might be running a little bit of a fever and don't realize it are reminded that they should go home and self-isolate. And another key part of that is frequency of service. If we were to go back to the same situation with public transit before, it would not be safe because we were already crowded into trains during rush hour and buses almost all throughout the day. So we really need to think about which routes are key for essential workers, which will be busy even as we transition to a reopening, and boost service there. Maybe it would involve moving buses from some of the less busier lines over to some of these areas that people are really starting to see crowding in. Allow people to know that they don't have to get on this bus because the next one's coming very shortly after. And it's not a choice between being crowded in an unhealthy and potentially risky way or having your pay docked or potentially losing your job because you have to wait a whole other hour and then be late to work.
What about standards like testing or even spaces between people when it comes to small businesses? What's the best way to go with that?
Yeah, it's such a struggle for our small businesses. In a perfect world, right, in many of these places across the world where people have managed to get the virus under control, there's been a directed effort to support small businesses. So again, the business owners and workers aren't forced to make bad choices. Right now, it feels like the choice is either I do something that might feel a little risky for public health, either I open without quite knowing if my workers are all healthy or have people coming in from the T and we're not quite sure. We don't have testing in place yet to know, or I stay shut down, which is safe, except then I'm going bankrupt and we're already behind on rent and employee wages and all of that. So we really need the federal government and relief sources to line up so that we're supporting the businesses that need it most. I think we've seen in some of the first rounds of the federal PPP program, the Paycheck Protection Program, that in fact it was the large corporations who had people, attorneys, bankers, consultants, helping them apply, and then they were first in line to get the money, which quickly ran out. It's been a little better upon subsequent rounds of relief, but it is still very much accelerating disparities because we see the relief that's available is not going to the businesses that need it most. So we need to find a way to provide that relief.
One other thing we're still contending with here is the demographic profiling of COVID-19 in connection with either China or Asian Americans, as the case may be. A lot of that might be just coming from the top, but what should be the response to that?
Yes, May is Asian Pacific American Heritage Month. And so this year has been a little bit different, not just because we're not gathering in person for anything, but because the community is going through a very difficult time. So many Asian Pacific Americans feel isolated, targeted, afraid, because we have seen a rise in hate crimes all across the country, perpetuated and empowered by the commander-in-chief, who regularly refers to the virus in a very racist way and leans into stereotypes about China and East Asia, and connecting it to the current situation. It's clearly a scapegoating move. It's nothing new to many minority communities who have experienced discrimination, racism, and xenophobia. So we are trying to use this moment to build infrastructure within the community and also reach out and strengthen those coalitions with other communities. I've been part of several efforts locally and nationally to ensure that we're speaking out and bringing people together. We're part of I came together with elected officials who are also AAPI and represent AAPI communities. So we have Boston's Chinatown, New York's Chinatown, San Francisco Chinatown, Minneapolis's Hmong community, Seattle, all represented and coming together. We've done some town halls every Friday in May, just to give people a chance to discuss what's happening and plan out how can we come out of this stronger as a community.